Welcome to Community Insight, a show about the family well-being movement. I'm your host, Valerie Frost. In child welfare, we talk a lot about prevention. Prevention services, prevention funding, prevention plans, prevention systems. But what are we actually trying to prevent? Are we trying to prevent foster care entry? Or are we trying to build the conditions families need to thrive? Those are not the same goal. And different goals create different systems. Today's guest is Zach Laris, founder and president of Child Welfare Wonk. Zach brings deep expertise in child welfare policy, federal financing, the Family First Prevention Services Act, and the structures that shape what states are able to build. In this conversation, we use Family First as the entry point, but the bigger question is whether prevention is too small of a frame for the family well-being vision we keep placing on it. Has Family First exposed an implementation problem, a policy design problem, or something deeper, a vision problem? I started by asking Zach to share his ideas on how he defines prevention.
There is not a shared definition of the term prevention. When we use a term that, like prevention, we're obscuring more than we illuminate. What it doesn't do is articulate an aspiration. So it comes from a deficit-oriented approach of we assume something is wrong, we're going to make the outcome slightly less bad. What it doesn't tell you is what is the vision for what every child and family in the United States needs and what public policy should do to get you there. And when we do that, what we're doing is smuggling what are really contestable claims on competing visions for the future into a conversation about mechanics of how to design the right kind of programming. And that's, I think, one of the core impediments to the field right now.
All right, so I want to make this a little more real and concrete and just re-explain what you just said. So you said like obscure, it's too broad, all these different things, and it's also use like this deficit framing. So per Family First, like per what it actually says in writing, what does it say we're preventing?
Well, that's a great point because it's often a slippery term that moves around too, and I think this is one of the challenges. Family First is actually quite specific in what it means in prevention, but then the conversation often widens significantly from there. So the design of Family First is pointed at prevention of foster care when a child can remain safely with family. So it's not preventing the crisis that brings a family to the front door of child welfare. It's not preventing hardship. It's not preventing any kind of crisis with parental mental health or substance use disorder or complex poverty or domestic violence. It's really that moment when you're at the door and the question becomes, does this child need to come into foster care? And the decision point is, could they remain safely home with services?
I wanted you to say that because I think that that's what's happening. That's what I'm seeing is that it does say preventing foster care, but you could have different ideas for that. Like my idea as an impacted parent, as an active family on what would prevent the system from coming into my life could be very different from an institution's definition of this is a family that could be on our radar and we want to prevent our staff from having to go out there and intervene for the reason of foster care. So we're going to send staff to do this thing to intervene prior to another intervention. And those two examples can be very, very different. So like, what would you say if you were to use the word prevention? Like, what would you say that you were thinking?
I honestly find the term prevention incredibly frustrating. I think when we talk about prevention, we're losing the plot because what are we preventing? Who is preventing it? And what becomes true when we prevent it? I think that is the place where, you asked at the outset of the conversation, do we all have, as a field, a shared definition? The reason that's a quick and clean no for me is because that's a really broad space. And I think the real opportunity and need for our field is to surface some of the legitimate disagreements that are bound to emerge from that, where folks will say, here's what I think should happen. Here's what I envision for every family. And to then stake those positions out lets you see, okay, well, then what can actually win enough of a political coalition to advance through Congress and become law? That's the real stress test for what can actually work in public policy. My question to that is always, what are we preventing? And I think the better question is, whatever your definition of prevention is, I think the way to redefine it is to say, what becomes true if that happened at scale?
Yeah, I would say my question is, are we building the conditions for families to thrive? And if we start the conversation from there and we start the conversation from what comes true at scale, are we so focused on like that fear and deficit based? Is that what we're thinking? Like, it might come in there if we have the conversation of, well, what are the risks? What could go wrong? Maybe it would enter in there, but that wouldn't be like where we're starting from, right?
That's right. And I think this is why also, in many ways, we're almost asking too much of Family First when we try to put that amount of freight onto it. Congress very narrowly defined what prevention is in a Family First context, but the significant thing that changed is you have, at the federal level, Title 40 of the Social Security Act is the big financing policy for child welfare. And the vast majority of that funding going out the door is tied to income limits that date back 30 years with no inflation adjustment. So over time, we've seen this declining federal investment, and it's been mostly tied to things like foster care, adoption assistance, and the administrative apparatus of child welfare agencies. And what Family First said was, you can have these open-ended federal dollars for this set of purposes, and there's no income test. If there's a risk of a child coming into the system, then you can pay for those services without having to go into a back office and put on a green eye shade and play with an Excel spreadsheet. That's a very significant and profound shift. And so even when folks feel frustrated by the pace of implementation or what's happening with Family First, it is worth noting that while there's some significant rate limits on what's happening right now with deployment of the law, there is some real opportunity to build some infrastructure and architecture around the shift that it represents.
So as you're talking right now, I'm thinking about the piece that you wrote that came out recently, right? So the Family First Light on Families, and just talking about that, the years of expenditure data and just like the administrative cost that's going in and the number of caseloads and all the things. I'm not going to retell all, we can link it in the show notes and people can read it. And reading that really quickly, someone might think, okay, well, Family First is not working. But your actual argument is more nuanced than that. And you started to explain this right now, again, that there is opportunity, that money can be spent. What do you think that the high administrative claiming is telling us, though?
It's an interesting question because people hear administrative claiming, and the first place that your mind can go is bureaucratic overhead or something that sort of sounds like, is this waste? Is this? And it's not that at all. In a Title 4E context, administrative funds, they're really the state capacity of the system. So in a foster care context, that's the funding that goes to training, to information technology, case management, all that kind of stuff. And those funds are tied into that same income test. In prevention, what's really interesting about administrative claiming is it's quite broadly defined. It has no income test, and it can be everything from the training and preparation to implement a prevention program, but it can also be all of the stuff that goes around services to make them possible. So if the case plan is you have mom is struggling with substance use disorder, is in recovery, needs to go to meetings, but also has shift work job with unpredictable hours, hard to find childcare, administrative claiming funds can pay for childcare. They can pay for transportation. They can pay for all the stuff that goes around the treatment in addition to the actual treatment service intervention. And so in many ways, the administrative funds are administrative state capacity. And that is one of the biggest things that is important to really pay attention to in Family First. It's not an equal opportunity for every state. You have to have enough infrastructure to make all of this new federal funding flow into a community and actually be able to make that kind of investment. That takes staffing, that takes training, that takes technology. It takes some real infrastructure. And I think that's one of the big lessons learned from the Family First implementation experience is, right now what we're seeing is a combination of some real challenges from the way that the law's standards exist around evidence and what you can actually pay for in terms of services. But just as importantly, you can't flip a switch in Washington, D.C. and assume that overnight every state will suddenly be able to magically do something at scale. It really takes time and effort and energy to turn an ocean liner like that.
Okay, so I don't want to oversimplify, and I just said that you had a nuanced response to all this, but
Yeah.
humor me here or don't. Push back if you want.
Yeah.
Would you say this is an implementation problem, a policy design problem, or a vision problem?
Do you mean the pace of implementation, or do you mean administrative claiming itself?
Well, you talked about administrative claiming, and you started to say that you need all these things around a family, and that's what we're paying for. So if we're paying for all the things, or we have the capability to pay for all these things, why is it still not reaching families the way it should? Like you talked about, like 53,000 prevention caseloads. So what's going on? Like, why is the infrastructure not being built enough? Do we need more money? Do states need support on figuring out how to unlock all the money? Whatever needs to be unlocked there. Is that an implementation problem, a policy design, or vision?
It's definitely a mixture of some real policy design challenges and some like last mile delivery implementation challenges to start. What I mean there is, to stick with the administrative funds and the kind of infrastructure capacity aspect of it, there's a real need to actually have enough capability to take an opportunity like Family First and turn it into something that's legible to your workforce and to the communities you're serving. So how do you actually go and pick out a menu of things to use and then design a program and roll it out and have it actually work? That takes effort, and there's some real trade-offs and questions to ask. If you're running an agency and suddenly you're moving to much more of a focus on a totally different approach and intervention, you can't just expect that you'll send a memo out to the staff and everybody will go, super, got it, okay, I'm on it, and now we're doing that thing. It takes some real work and effort. I think the real design challenge comes in the way that the law is structured around evidence. And I want to be clear here, too, that this isn't something where the problem is that Congress, wasn't thinking things through or was up too late in the middle of the night, some staff people, and didn't have enough coffee, and here we are. The evidentiary standards in Family First really served a couple of purposes. One of those was to build a political coalition. So Family First didn't pass in a vacuum. It passed through a Republican Congress, and it was signed into law by President Donald Trump. And so having a frame of we're going to pay for what works was the price at the door to get into any kind of conversation about expanding open-ended federal dollars. And so you already, to reach that point of even having the bipartisan willingness to pass anything, had that conversation of, okay, there has to be some evidence, so how do we bake that in? And from there, what you see, too, is the use of the evidentiary standards as a tool for cost containment. So the Congressional Budget Office, for those who aren't in the D.C. Beltway land, is one of the most critical institutions in the whole policymaking process. Kind of sits off on its own in the sidelines, isn't something that usually gets a lot of public attention, except for those big inflection point moments where you might see a headline that says, oh my goodness, this thing's going to cost $11 billion over 10 years. That's the Congressional Budget Office that's doing all this forecasting. So they've got all these economists and nonpartisan analysts doing that work. And so there's always a back and forth game of, well, what's the projected cost of a bill like Family First? And Congress anticipated that Family First on the prevention side would cost about $2 billion over 10 years. Certainly we have not seen that play out in that way. But that was the process of going back and forth and saying, okay, well, what if we limited a little bit more? What if we required a few more studies? And so what you get on the back end is a real challenge, that what looks like a menu of programs that you can choose from is really a mirage. And I say that because Family First creates these 3 tiers of evidence. So you've got promising practices, supported, and then well-supported practices. And what the law says is you need to spend 50% of your services expenditure in that top tier of well-supported. Well, what would you do if you were running a state? I know what I would do. I would say, okay, well, what's the stuff in the top category? Because the governor's in a tough election this year. I don't want to lose my job. I'm not trying to put myself way too far out on a limb when it comes to cost disallowance or accidentally overshooting that target. So better play it safe. It's still early too. So, hey, let's kind of take it easy here and just start with the stuff that we know is going to be permissible. That category is really small. It's not a lot of programs there. So you have what looks like hundreds of programs that are in the clearinghouse that have been reviewed, and then you've got a subset that are in those three categories, but it's a much smaller subset that are in that well-supported category. And they're expensive to implement because they come with a lot of their own costs even to roll them out. And so that has become a real rate limit and the speed governor on Family First. And that is a thing that I think really is a policy design question to talk through. The vision thing, I think, is a much larger question for the field. And I think in many ways, when we try to say Family First isn't doing prevention or isn't doing primary prevention or whatever our preferred way of defining it is, what we're missing is, well, what was Family First here to do? And we're putting a lot of hopes and dreams and expectations onto something that was never designed to hold all of those things.
Okay, that was a lot. So I'm gonna back you up a little bit because I do want to go back to the evidence standards, and here's where I'm gonna bring in the lived experience challenge here. So I don't know if you've said the word yet. I don't know if I've heard it, but we're talking about the clearinghouse.
Yep.
And the role that the clearinghouse plays in potentially limiting what states can claim or to build. And so the way that I see it, when you talked about all these tiers and it has to be up here and all of that. And again, this is from my lived experience vantage point. This is not from, obviously, you've been in these conversations and part of decision making. What it appears to me is there is a standard of being institutionally legible. Mm-hmm. And that you have to make this program institutionally legible. And what that translates to me and to other families is this is now a replica of the system. And so you're saying prevention, and again, we don't have a shared definition of prevention, right? Because we could have that deficit-based version of prevention. So what it does is it just becomes an extended arm of surveillance, of control, and then who defines those tiers is institutional and bureaucracy mindsets. And so when I hear, oh, this has gone through the clearinghouse, this is evidence-based, I'm like, for who? Going back to our original questions, like, is this something that would help families thrive? Or is this something that looks good on paper for collecting data and measurements? And can agencies count the number of participants and say it was successful and not really measure whether anyone had any really great outcomes from it?
I love your legibility framing because I think that is exactly what an institution like a clearinghouse exists to do. It makes programs legible. It makes populations legible. When you think about any form of family policy, what it's trying to do is make families and services and whatever else it's doing all equally legible to those pieces of the policy machinery. And I think you're pressing on an important seam here and a couple places where there is a real tension point within the law. So, you pointed to the deeper question of, is this even meant for the population it's serving or tailored to them? In many instances, it's incredibly challenging to actually map that. So the clearinghouse is looking at, do you have randomized controlled trial studies? Well, you can go ahead and guess that it's pretty rare that you have a lot of high-fidelity RCT studies that are done with a child welfare involved or adjacent population. And so you're already often adapting from another population design to try to fit to the population of families who you would be serving through these services. But the other piece that you're really pointing to, and that I think is an uncomfortable tension that we all have to talk through and think about here, is it's that balance of you have to be able to make something legible to be able to pay for it. And yet at the same time, what you end up losing is the locally specific community-driven context that can actually make for an innovative program that works for the population it's serving. So what we have right now is it's a one-size-fits-all menu. It's, hey, I don't care if you're in Kentucky or California or Florida or New York, this is the menu, and you can pick what you'd like. It's an all-you-can-eat buffet, but this is all we have as well. And that's a place where a lot of what you hear from families, and I'm sure this is part of what you're pointing to, is a desire to say, well, what about the program right here in my own backyard that's doing some interesting work but isn't big enough to have a big research institution come in and do a fancy study for 2 years?
Yeah, and that's the thing. It's not an equitable entry into the clearinghouse. And so you're only getting the people that have the most resources, the people that can generally be like the furthest removed from the ground, and then the things that are proven through the definition of community legibility don't make it because they're not institutionally legible. I don't know if this is like an exact one-to-one example, but it's top of mind for me, so I'm gonna field it to you and see what you think about it. So my daughter had a dentist appointment this week, and we've been going to something for a bit of time, and not to like tell on myself on the family well-being podcast here, but I'm just trying to figure out root causes, and I want to find a dental provider that will do more than just one size fits all appointment. And what I realized yesterday when we went to the appointment is the only options on this dental provider's menu are what they can bill.
Yes.
And I want them to be able to bill time to talk to me about options. I want them to bill time to talk about my child's diet and to talk about how they're sleeping. I want them to be able to bill time to explore different pathways. And it's like all they have is, I can give you a referral to this other specialist, or I can fill a cavity, do a root canal. And it's like, when I am speaking the language of I'm a mom and I'm just wanting to ask questions, and they just don't have the language, they don't have the options there. And so we're just totally different, two different tracks here. And I feel the same thing with prevention and like the clearinghouse and all this, where it's like, I want well-being, and I want to achieve Maslow's hierarchy, and I want all of that. And it's like, we need randomized controls. We need to not waste money. We need this. We need a clear like rationale that this is preventing foster care. And it's like we're not speaking the same language, and this is not working.
I think you're onto something important. I mean, I think in many ways this is one of my hypotheses for why we see the level of administrative claiming that we do. So about $6 in $10 right now spent on Family First go to administrative claims. And that's nationally. So for about half of states, it's actually well over 90% are going to administrative claims. And when you look under the hood on that, oftentimes what seems to be happening is that when you have a pretty limited menu of options, the states that are being creative about how can we best use these dollars in the kind of way that Valerie's describing is to say, okay, well, what if we use administrative dollars for case management? And what if we train our whole staff on motivational interviewing and some of the other interventions that are available in the clearinghouse? And then we can use administrative claims to support that and offset some of those costs so we can invest in our workforce and try to expand the quality of time and what they're doing with families. Because otherwise, you have maybe a few programs to pull off the shelf, and that's what you have to offer. So home visiting can be really great, but if what you need is different from one particular evidence-based model of home visiting, that's not going to meet the moment for you. But maybe having a caseworker who's willing to just sit down and look you in the eye and actually listen to you and hear what it is that your family needs and then think about it instead of going, here's a list of stuff that you can call, that can make a much bigger difference.
What values do you think are embedded in the way that child welfare talks about prevention? Do you think the current prevention frame, do you think it still assumes that something is wrong with families?
I think inherently a term like prevention does assume something is wrong. I think that's part of what's so challenging about it and why I find it such an unsatisfactory term. Because anytime we're talking about prevention, you're talking about trying to stop something from happening. And when we're talking about child welfare, the assumption is something is going to happen in your family that's going to bring you into this system. It's a pretty charged assumption to have, and comes with a lot of assumptions about who you are as a parent, what's going on with your family, what's available in our programs. I think imagining it as a way to avoid the higher acuity engagement in the system, I think, is the other thing that a lot of system leaders are doing. What can we do to maximize the value that we can provide to your family? What can we do to try to get the best possible outcome for you? That is a much more positive and outcome-oriented approach than the deficit and just trying to hedge against something bad.
All right, so let's take prevention and family first. Let's put those aside, because you have obviously much more knowledge of just federal financing and what is within the realm of possibilities. So knowing how much money is available and how much money federally, how much money states can receive, and what the need actually is for families, what would you call it? Like, what would you call it instead of prevention? And how would you unlock it? Would it be through risk? Would it be through need? Would it be through eligibility?
At the core, what we're talking about is family thriving. What does it look like for the federal government, whether you're Democrat, Republican, or right down the middle, to say, how can we invest in a thriving, vibrant American economy and workforce to be a long-term global competitor? Well, the question I always have to that is, where is the family policy conversation around that? Because families are going to be the foundation of any strong society. And so to me, I think the larger conversation we open up is when we start to talk about thriving families and family well-being and child thriving and well-being. When we talk about changes to how we pay for foster care, we're still fundamentally buying foster care. When we try to boil the ocean and talk about reimagining the whole state of the society, it becomes really challenging to have anything to focus on. But when you look at that space in between there of where do health and human services and economic policy intersect and have an impact for families who, because of their experiences, are going to be at the greatest risk of coming into contact with a system like child welfare, that feels like a fruitful place to me to build some new infrastructure and do some new stuff.
Okay, so let's go into vision then. What would a real family infrastructure agenda include?
I think first and foremost, when you talked about legibility, I think there's a real importance to making making families legible in a way that doesn't assume that you have to fit into a narrow set of boxes. So being able to fully look at the whole panoply of American families and have a way to account for that. And to be able to look at the inevitable caregiving that happens in families. Like, we've had this shift from a much older sort of 1950s model that was much more rigid and assumed like you're going to have one parent who's a breadwinner and it's probably dad and mom's probably going to be at home, and here's this assumption of roles, and that's kind of baked in. And then we quickly went from that to, you can have unlimited choice and options as long as you're able to figure out how to pay for those things, and often ends up meaning that you have, in a two-parent household, everybody's working, or in a single-parent household, really trying to do everything and juggle all that individually. What would it look like for us to instead make the work of caregiving legible? Everybody in this country does all kinds of caregiving across their lifespan. Whether you're talking about the raising of children, whether you're talking about caring for aging loved ones, whether you're talking about caring for yourself at times of sickness and things like that. Inevitably, it's predictable that we're going to have needs for all different kinds of care, child care, early childhood care and education, all the way through to caring for family members. And so being able to actually make that legible and then give options to people so that you can actually make that fit your own family's context. But that comes down to your point about legibility. You have to make it legible enough that it doesn't assume that you have to fit into one or two narrow prescribed choices. So
what supports would count then that we currently treat as like outside of the frame?
I mean, I think, for example, there's some interesting conversations, like the team at Capita is doing some work around this. Like you see people like Patrick Brown and Elliot Haspel and Ivana Greco doing some work around this, looking at something like childcare, and taking it out of the usual conversation, which is about either, sort of a binary choice, or assuming that the whole conversation is around, center-based childcare, and that's really the only option, to instead say, how do we give every type of family options, whether you want to have center-based childcare, whether you want to have an in-home daycare to take your child to, whether you want to have a parent who's at home and is receiving some sort of support, either for themselves doing that work, or relative or family friend doing some caregiving, or to be able to get, even if you're a stay-at-home parent, to have access to childcare because maybe you need to be able to go to the grocery store and you got 3 kids or something like that. I think that's like one concrete example. There's some really interesting conversations going on around paid leave. What does it look like to design a paid leave program that actually works for the vast majority of people and for the vast majority of businesses and states to be able to actually take leave and use it, and not have it be something that sounds good on paper but you can't afford to avail yourself of.
And when you were talking about the child care piece, I was thinking about the child tax credit, of like money that follows the child, so that any caregiver stepping in, the money's with the child and it can be used in different ways. Would you think about something similar when it comes to child care, that there is just money for child care that could be used for a babysitter, for a nanny, for a family member, for family child care? I guess, I don't know what your thoughts are on the child tax credit.
Yeah, I think that's a really interesting idea, right? I mean, I think the more that you can make benefits portable and flexible, I think the more appealing that's going to be. As we see, the whole economy is transforming, right? I mean, we have so many outdated policy structures that are completely failing to meet the moment of the challenges of right now. So we've designed all of these programs for a workforce that assumes that you go get the job at the factory down in your city and work there for 30 years and you get the watch when you retire. And it's not really the common experience anymore. People move around a lot. People have changes between what they do, but we have policy that doesn't really account for that. We still have, as a core part of our health insurance system, employer-sponsored insurance. I mean, that's an outgrowth of a workaround to wage caps during the Second World War. And from like a kind of funny outgrowth of that thing, we now have, it's baked into the way that our system's set up. And yet that means that oftentimes you have parents who might say, want to try a new job or want to start a business, but are then holding back to say, well, but how do I make sure that I have affordable health insurance? These are all things that they'll require trade-offs, right? I mean, we're not just going to be able to have, magic wave a wand and print free money to get whatever we want. There'll have to be some kind of accounting for how do you make this work and how do you make it sustainable. But I think those are conversations for us to have. And I think focusing on what can we do to change at the margin 10% more or less on this program, or adding a couple more allowable uses of funds, is really getting us stuck.
Okay, so I want to go into governance then, because I brought this up earlier. Who is really defining the success of the programs, or where the funding is going and all of that? Because we go back to the clearinghouse and having to have randomized controls. And I know we've talked about this previously, bringing in parents, impacted people, those advisory structures. And we've spent years, it was previous to Family First, but I think it's kicked up a notch after Family First, like building advisory councils and lived experience panels and listening sessions. Like, if we were to really understand that the options that families need, how do we find the right balance between someone like a community saying just endlessly print money, and then this like institutional legibility piece that there needs to be some oversight and monitoring and all of that? Like, there has to be a structure, but it also has to meet the need of families and have family voice. Like, what do you think would create some sort of balance between that?
I mean, honestly, Valerie, that's why I'm intrigued by the work and leadership that you're involved in, because I think a failure mode that we often see with this stuff is an assumption that change is going to come from an existing institutional power center saying, congratulations, today is your day, and here is power for you to make a big, important decision. And it just never happens, and it's not going to, and waiting for that is a category error. Anytime you have that kind of institutional inertia, you're not going to have decision makers, at least at scale, decide to give away something like that. It's that old Nancy Pelosi-ism of power is never given to anybody, it's always taken. And so I think fundamentally, the kind of change that you're describing is only going to emerge when you see the development of unignorable infrastructure and perspectives. And in a deep way, that's a lot of what I see you doing and talking about and thinking about, and part of what I find so intriguing about your work.
No, I completely agree. We shouldn't have institutional legibility here, community needs here. There's got to be some bridge, and that's a role that I play a lot, right? Just being like that intermediary and bridging some feedback. So again, it has value, but on what you just said, like, I worry that the field is building participation structures without building that independent power, right? And so, like, the way to meaningfully learn from families can't be limited to being absorbed in the systems that they are being asked to critique.
Yeah, I mean, I think what you're pointing to fundamentally is the difference between user experience input and design taking the pen, right? If Apple invited us to go try out some new iPad, we'd say, wow, that's really cool, and get to play with it and fill out a survey. But we wouldn't think, this means that I have meaningful decision-making authority within this giant company. We would think, well, they're gathering some input and they're going to make some decisions. And I think where the misunderstanding emerges is that's oftentimes what those kinds of structures are doing. And to your point, that's not inherently a bad thing. There's a benefit to having the ability to get that kind of feedback and say, hey, I'm designing a program with these federal resources or state resources, and I want to make sure it's actually working as I'm intending it to. That's great, but it's never going to, on top of that, also then invite in someone to redesign it. And I think that's where, when the expectation shifts to that, there's a real misunderstanding and misalignment.
There was something that you brought up earlier that I want to bring into this conversation. As I'm going to say, it's actually stuck with me. I've pondered on it quite a bit. Like every few days or so, I'm like, you know what? I want to go back and have an answer for Zach here on this. We had talked about ICWA, right? So with this independent power and with something that can't be ignored, the indigenous population has had a movement around organized power and sovereignty and self-determination that has had wins. So, like, from your understanding and observations of that, like, what have you seen be successful that other impacted people could learn from?
Yeah, I mean, so certainly don't want to overgeneralize or overstate my read on what happens there, but from the work that I've done, from what I've seen in that process, I think oftentimes we hear the Indian Child Welfare Act lifted up as the framing is, gold standard of child welfare practice, and elevated as something, a model to replicate elsewhere, that sort of thing. And often in those contexts, what I find interesting is when you hear the analysis of of how it emerged, the description is often a sort of neutral, and then in the 1970s, like, this happened and this law passed, a lot of passive language, and now there's ICWA. And the real explanatory factor there is it's part of this whole movement of indigenous self-determination activism, where you had a whole effort that was concerted, and you saw a bunch of laws that passed through Congress to provide self-determination in a healthcare context, right? With ability to make decisions about resources and how to invest those into the community hospitals and clinics that Indigenous communities actually want in an education context. And child welfare was a part of that larger framework. And that didn't emerge because a bunch of senators one day said, we should do something really kind. It happened because you had a movement that said, we've built enough momentum and power that this is an unignorable topic, and we expect to see some sort of institutional change and answer. And that's the framework of laws that emerged from that.
I think as we are considering what's next, again, there's value in what exists and what's been happening. But for me, I want to see that growth of the organizing power, and really being for impacted people, young people aging out, and parents to be able to build power without needing institutional permission. So I would say throughout this episode, and again, weigh in on your perspective here, but I think what we've talked about is that a true family well-being system can't be built through better services alone, through increasing the menu of evidence-based, right? It also needs different values, different infrastructure, and a different distribution of power, which is what we were just landing on. So again, from everything we talked about today and everything that your work is focused on and your experience, if policymakers and advocates and parent leaders take one thing from this conversation, like what question would you want them to ask themselves before drafting the next prevention policy?
What is your vision for what should become true? If you find yourself talking about how we need to do more prevention, or even when it drops into specific policy ideas, but this is the thing, it should be this one or this economic package and tax policy or something. The question to me underneath that is always, what does that unlock for you? Why is that the tool that you're reaching for? Because right now we have to have some more conflict around long-term vision for what's next to be able to surface what's possible. And until we start doing that and having those, not a theatrical crossfire performative thing, because there are competing claims on what's possible, and there are multiple potential answers to those things, and there's not one single source of truth. But we keep treating it like it's an engineering problem, and I think that's where we're really missing it. So my question is, what is your vision? What do you want to become true, and how can you communicate that in a way that really enrolls people?
I don't know if I'm allowed to say this. It might get edited out. I would actually be okay at this point if we got some rock'em sock'ems and just went in the ring, and it's like, tell me your idea and we'll keep punching until we figure something out.
The policy Thunderdome. Yeah.
I'm kind of here for it at this point. We actually really do need some conflict. We do just need to hash it out. Instead of someone saying, I have this viewpoint, I'm going to stay here in my echo chamber. I'm going to stay here in my echo chamber. When you talk to enough stakeholders, there is a core. We all do want children to be safe. Can we start there, and can we just hash out the rest of the stuff? Okay? Instead of being so fixated on how you're different and how I'm different and what I want and what you want. And if you can frame it in, this is someone, your actual neighbor. This is your friend. Would you care differently? So I'm okay with the dome. I would introduce it. But I would say this conversation, again, is not just about whether Family First is working. It's about whether prevention is big enough to hold the vision that we keep placing on it, right? And so if prevention only means preventing foster care entry, then the field can stay focused on eligibility, evidence, claiming, compliance, and intervention. But if the goal is family well-being, then the questions become bigger. What makes family life possible? Where should prevention live? What values are embedded in the policies we design? And what would families experience differently if we stopped asking them to earn help through risk? So Zach, thank you so much for bringing all of your wisdom and experience and knowledge into this episode, and for coming and being grounded with me in the family realm as well.
Thank you so much for having me, Valerie. Really appreciate the conversation.
That was my conversation with Zach Laris. I hope this conversation inspired listeners to consider the question, is prevention big enough for what we're trying to build? Or even the right idea? Be sure to follow the podcast for new episodes. You can also rate and review the show on your favorite podcast platform and share it with others interested in the future of family well-being. We thank the Annie E. Casey Foundation for their continued support of the show. And thanks to our sponsor, Sunlight. Sunlight connects families and professionals in the child welfare system with innovative technology tools that improve communication, protection, trust, and transparency for better outcomes. Community Insight is produced in partnership with Imagination Factory and 14th Street Studios. Thanks to Matt Anderson, Tavon Lewis, Michael Osborne, and Morgan Honecker. The opinions and conclusions expressed in the podcast are those of the hosts and guests and do not necessarily reflect the views of the Annie E. Casey Foundation.